Hi folks, Dr. Ed Beyer, Clinical Director of Beyer Stem Cell Institute in Tinley Park, Illinois. And today we're going to talk about how to do proper stem cell therapy for regenerating broken down arthritic joints, knees, hips, shoulders, any joint in the body. So exactly what are we going to cover today? We're going to cover what are stem cells and what do they do, the proper type and source of stem cells used for joint regeneration. This is where people are messing up. What two things have to be added for stem cells to work fully? We're going to compare stem cell regeneration to what traditionally people get through standard medical care, things like medications and cortisone injections and joint replacement and joint cleanup surgeries. We're going to teach you how to actually research this, the proper way to do it, and who's actually doing regenerative medicine. You're going to be surprised with some major institutions that are actually doing this because it works. Stem cells and the FDA and Big Pharma, what's the deal? Are they in or are they out? And could it be right for you? Because it's not right for everybody. So we're going to get into that too. So what exactly are stem cells? When we're born and fully formed, we are made up of 210 different types of cells, and all those cells are very, very different. But it's not that way when we're created. When we're created, we got mom's egg and her DNA and dad's sperm and his DNA. They join forces and they form one cell called a zygote. And this zygote, when I talk about this, it's just amazing to me. Within a week, that zygote, that one cell, becomes a group of 50 to 100 cells, and that group is called a blastocyst. And these cells are known as pluripotent embryonic stem cells. Now, I'm just going to kind of sidetrack here. We do not use embryonic stem cells for our therapy. So that's a point of confusion I want to clear up. So they're pluripotent, plural and potent, because each one of these cells in the blastocyst have the full capacity to develop into any one of the 210 cells that make us up. And that's what some of these do in the 40 weeks that we're in our mother's uterus. So they're going to go through two steps, or two processes. They're going to differentiate and become the 210 cells, or they're going to go through a process that many people don't know about called derivation. Some of these cells don't become specialized cells. They replicate and mature into adult stem cells. So by the time we're born, 1 out of 10,000 of our cells is an actual adult stem cell. Why are we created this way? These adult stem cells are in our body and they're waiting for any type of tissue breakdown, whether it's through disease or injury. They go to that area and they repair it. You break a bone, what repairs the bone? Bone stem cells. You cut yourself, skin stem cells will heal that. So there are different stem cells in the body that repair specific tissue. The problem is as we age, the number and potency of our adult stem cells greatly decreases. This is why we degenerate faster than we can regenerate. Regeneration goes down, degeneration goes up. Now, the type of stem cell that we have in our bodies to repair joints, cartilage, ligaments, tendons, bone, synovial lining are called mesenchymal stem cells. Now, there's two sources to these mesenchymal stem cells. We have them in our body, in our bone marrow and our fat tissue, but we've discovered in the year 2008 that there's mass quantities of these mesenchymal stem cells are found in an area of the human umbilical cord known as Wharton's jelly. These are the best and easiest source of joint regenerating mesenchymal stem cells. So let's talk about what we traditionally get when we go to our medical doctor when we have arthritis of our joints. A real common thing is cortisone injections or corticosteroids like prednisone. Now, I will tell you, these different cortisone and corticosteroids are wonderful at decreasing inflammation. But the problem is, at what cost? These are highly destructive. They actually break down the joint tissue, bone, cartilage, ligaments, and tendons. That's why your doctor will only do so many of these injections per year, because they actually tear the joint apart. And so the other thing that I hear is people say, I got a cortisone injection, I felt great for 3 months, and then it went away. And then I got another one and it lasted a month. And then I got another one and it didn't work. Because as soon as you inject those corticosteroid or take it orally, it tears down tissue. Not only the joints, but our gut barrier, causing something known as leaky gut. It raises blood pressure, causes cataracts, stings the skin, and disrupts our own natural corticosteroid in our body called cortisol, which can lead to a lot of bad things. So cortisone eats your joints. The other type of medications that are common that many of you are taking are called non-steroidal anti-inflammatory drugs, or the NSAIDs. These are like aspirin, ibuprofen, Aleve, Celebrex, meloxicam. There's a ton of them. These are horrible to the digestive system. They break down the stomach barrier, causing ulcers and bleeding. They cause a lot of damage to the gut. I just read a study that if you take prednisone for 10 days, your chances of osteoporosis go up 270% the rest of your life. If you take it for a year, your chances of osteoporosis go up 21,000%. They cause high blood pressure, kidney and liver problems, and they also destroy the gut barrier, causing leaky gut. And then there's the opioids. We don't really need to get into the side effects of opioids. Over 60% of addictions occur from people starting pain medication for some sort of pain. Then the other options that we have are surgery, right? And a lot of you out there have had surgery, I'm guessing, but my audience usually always has some in there. So the most common one we see is knee replacement and hip replacement, but there are others: ankle, shoulder replacements, laminectomies in the spine. The problem with surgeries is a lot of them don't work. You're down for 3 to 6 months for rehab, so there's a lot of downtime. And with joint replacement, like knee and hip, they only last so long, so 50% of people require a second surgery. They permanently lose range of motion. If you talk to people that have had these surgeries, they're usually not pretty happy. And they can cost a lot of time, pain, and money. So what do all these medical status quo treatments have in common? None of them regenerate tissue. The only option that we have, folks, to regrow new tissue is regenerative medicine and properly done stem cell therapy. Healthy, donated, and FDA-regulated human umbilical cord mesenchymal stem cells and growth factors to rebuild the cartilage and ligaments and tendons of your joints. So our bodies really are self-healing machines, and they use stem cells as their own internal repair system. Any healing event in the body is a stem cell event. But what happens to our stem cells as we age, they go down in number and potency. If you don't believe me, look at this x-ray right here. This is a guy who came and was scheduled for knee replacement. Knees is the number one thing that we see. And he's got, on the left, he's got bone-on-bone knee. He did not want to have knee replacement. He heard about stem cells. We did one injection, properly done mesenchymal stem cells, and look at his knee afterwards 8 months later. The darkness in between the bones is newly formed cartilage. So in mesenchymal stem cells, it's been around for a long time, and there's a lot of research on it, but here's what you don't do. Don't go to Google and Google stem cells. You got to be more specific. You got to Google mesenchymal stem cells and joint regeneration. And don't look at everything. What you want to do is you want to look at the National Institute of Health, or PubMed.com. That's the most respected, non-biased search engine for any medical advice or procedure. So that's what you want to look at. And there's over 6,000 pages on there about mesenchymal stem cells, and it's all positive. Even the Mayo Clinic does stem cell therapy. This is a picture that I took right off of their website. Mayo Clinic does it for joint regeneration, for knees and for hips. So the evidence is in. Proper mesenchymal stem cell injections, proper work for arthritic orthopedic conditions. There's a lot of people out there saying it'll work for all this other stuff. Don't believe the hype. We know it works for joint regeneration. Knees is the number one thing that we see because it's the major weight-bearing joint in the body, but we see a lot of hips, shoulders, neck, low back, elbows, wrists, ankles, and feet. So how do we get these cells? It's a question that I get from a lot of you, and a lot of you are probably wondering. So when a mother is 7 months pregnant, they're going to ask her, listen, when the baby's born, there are certain medical conditions that your baby might have. They're really rare, but if your baby has them, he or she will benefit from stored stem cells from the umbilical cord and amniotic tissue and the placenta. Do you want us to save it? And mother was like, why would I not want that? So the baby's born, baby's fine, and the mother consents to donate these tissues, these stem cells, these birth tissues, umbilical cord, amniotic membranes, and placenta to a tissue bank and the American Association of Blood Banks. There, the National Institute of Health mandates sterility testing. Then labs can purchase these cells, these stem cells, and different birth tissues, just like a hospital would purchase blood from a blood bank. Now, this is an important point. You want to make sure that wherever you go to have this done, that the doctor or the clinic is getting stem cells from an FDA-registered, regulated lab. There's a lot of people, a lot of labs out there that are not, and they sell these stem cells for less money, but they don't work. So the labs that we use are FDA registered and regulated. That's a very important point. After FDA approval, these cells have to be cryogenically preserved, and they're shipped to us cryogenically, and they're placed in our cryogenic freezer, 190 degrees below 0 Celsius. They have to be that way for them to stay alive. Then they're thawed right before the injection. So what happens after the injection? The stem cells are going to do one of two things. They're going to start formulating new cartilage, new ligaments, whatever you need. Because people come to me, they're like, I'm bone on bone, how are they going to help me? What they don't do is they don't resurrect your old dead cells. They actually make new cells, right? And then the other thing that they're going to do is they're going to self-replicate. They're going to make more of themselves. So one of the products we use has 1.2 million mesenchymal stem cells in it. And because they're from umbilical cord, they replicate really quickly. Within 28 hours, you're going to have 2.4 million. And another 28 hours, 4.4. Because you need billions of these to really regrow tissue. So that's really an important point. Who would we not do this in? What are the contraindications? If you have an active infection in or near the joint that you want to be injected, if you're pregnant or planning a pregnancy within 4 months, if you're undergoing active chemotherapy or cancer treatment, if you're diabetic and your A1C is above 8%, we will not do it. It won't work that well, right? And if the joint has been totally replaced, we won't do that either. So one of the questions we get is, how many stem cell treatments will a patient need? Folks, this is where people barely believe me, but I'm telling you, I've had it in my shoulder, my knee, my foot, and in my thumb, and it took one injection. One treatment is all that's needed in almost all cases. Why? Because these cells self-replicate up to a year. That's the reason why we use brand new human umbilical cord and not our own cells. There's a lot of people out there doing stem cell therapy. They're drawing their own, the patient's own stem cells out. I'm 60 years old. I'm not going to want 60-year-old stem cells injected into my knee or wherever I need it. I want to use brand new ones, okay? Now, typically we'll follow up if it's pertaining to the knee with hyaluronic acid therapy. That depends on the patient, and we go over that in the consultation. Hyaluronic acid acts as a scaffold or a mesh, so these stem cells have something to cling to. But fortunately, the human umbilical cord tissue has some hyaluronic acid in it, and it acts as that scaffold protein for the stem cells. How long will it last? It's going to last as long as it took for your joint to degenerate. It's like if you changed a tire. How long is the new tire going to last? Well, not forever, but it's going to last as long as the last one. And so that's why it's very important that we do a follow-up visit, about usually 4 to 8 weeks after the injection, where we give you range of motion exercises. That's a really important point. So another question that we get, and you're probably asking yourselves, well, when will I see results, right? 15% of people get it right away. When I did my knee, I started to feel it in 6 weeks. Within 2 months, all my pain was gone. When I did my thumb, my plantar fasciitis on my foot and my shoulder, it was immediate. By 8 weeks, 80% are seeing results. But you have to remember, this is an important point, most of the tissue regeneration occurs 3 to 8 months after the injection because these cells are self-replicating. And improvements can take up to 1 year. So there's 6 key points to successful stem cell therapy. Number one, as I already stated, you got to make sure that these cells are obtained from an FDA registered regulated lab. You want to use the mesenchymal stem cells from human umbilical cord and not your own body. The injection has to include some hyaluronic acid and exosomes, which are specialized proteins. The stem cell injection needs to contain those exosomes, and the cells should be cryogenically frozen right up into the injection. If the doctor's pulling it out of a refrigerator or something like that, get out of there. You're about ready to get ripped off, okay? And then you got to do the range of motion exercises 4 to 8 weeks after the injection to get the range of motion and strength back into the joint. That's really important. A lot of patients don't return for that visit because they're feeling great, and don't be that person. So folks, I love sharing this information with you. If you've enjoyed what you learned, don't forget to subscribe for more upcoming videos on stem cells and regenerative medicine. And also, please, if you know people that are suffering with arthritic joints, please like and share for more great content. I'm Dr. Ed Beyer of Beyer Stem Cell Institute. Have a great day.